So let's start. We are starting with unit number 6 of block 2, which is on prenatal development and care. Yeah, it's called prenatal development and care. And so we know how in this unit it has been described. Basically, the purpose of this unit is not to describe the whole course of prenatal growth. The purpose of this unit is to tell you that how important this period of development is and what is the care that the mother needs to take during this period. That is the purpose of this unit. So we know that conception happens when the sperm unites with the ovum, and the prenatal development, the period of pregnancy, is up to 9 months, and it is during that period the intra-uterine growth is divided into 3 stages: the period of ovum, the period of embryo, and the period of the fetus. So I'll just go back again and we'll take it one by one. So period of ovum is from conception to 2 weeks. At this time the zygote is still multiplying as it is travelling down the fallopian tube, and it is multiplying, and it differentiates into a mass of inner and outer layer of cells separated by a hollow cavity. The inner cells form the baby and the outer cells form the placenta, umbilical cord and amniotic sac, which are the structures which support the baby to derive nutrition from the mother. So the zygote at this time is still travelling down the fallopian tube after the ovum has been fertilized by the sperm, and it is only by the end of the 2nd week that implantation will be occurring. Oh sorry, I went to the, yeah. So the next stage is the period of the embryo. Embryo is called when from the time of plantation till the beginning of bone formation. When the bones begin to form, that time the period of embryo ends. So this period of embryo, we can say, lasts from 3rd week till 8th week. 8th week meaning it will be the first, the end of the, it will be about 2.5 months from the time the conception has taken place. So development in this first 12 weeks, 2 weeks we are taking of the conception time, and then we are taking the next of the time from the period of the embryo. This time is very, very important, very, very critical period in the development, because it is at this time that the all the organs, tissues and systems of the body, the blueprint, it is forming at this time. And at this time, you have read about the directions of development. Yesterday we spoke about, yesterday and day before. We know that development follows 2 directions: head to toe and center to end. So head to toe meaning that the first organs to form are the brain and the spinal cord, and we know that the entire activity of the human body is controlled by the brain and the spinal cord, and this is a very, very important critical period for the development of these organs. If the mother suffers any type of infection during this period, it can critically damage the developing child inside. If she has the same infection towards the later part of her pregnancy, let us say the 7th or the 8th month, then at that time the effect is much lesser than what it is in the first 12 weeks after conception. So because the period, the zygote is multiplying at a very, very rapid rate, and all basic structures are being formed. So center to end direction of development means that all the organs on the center part of your periphery, the heart, the lungs, etc., they will be the ones to form first, and later the arms and legs will come. By the end of so this is a quick run up, by the end of 4 weeks, eyes, ears, nose, etc. have developed, and small projections of arm and legs are formed. Between 5 to 8 weeks, the sort of baby's face begins to have a human appearance, and the reproductive system gets formed by this time, and you can know the sex of the child, though we must know that it is against the law to do any sort of sex determination. This is only for biological information that I am telling you. Sex determination is unlawful activity and should not be practiced by any individual. If it is practiced, it can cause you to go to jail. So then by the time at this time the placenta and umbilical cord are also formed. The embryo is about 1.5 inches long, and it is enclosed in the amniotic sac. Amniotic sac is a fluid-like covering outside the baby. So this amniotic sac serves the function of protecting the baby from any jerks, etc. that the baby may experience. Then the third period is the period of the fetus. It starts from 9th week till birth. And when do we say the period of fetus begins? When the bone structure begins to form. That is this. And at this time, the basic structure which has been laid down, that gets refined and the baby starts growing in size. As we can know that in the first 3 months it is not visible. First 4 months also sometimes the pregnancy is not visible. But later the pregnancy is very much visible to the others also. And of course after this it is followed by the birth of the child. That birth of the child is known by the onset of labor, which can happen in different ways. Either the clot which keeps the at the end of the lower end of the uterus, that is removed and there is discharge of blood, or there may be discharge of water, or the woman may experience labor pains. That is how we know that the birth of the child is near. And it is hugely advised, though of course we in cities may think that everybody goes to the hospital, but in rural areas many people are still getting birth done through untrained midwives, which is a cause of lot of complications in the mother and the child, often also leading to the death of the child. So birth of the child must be done only under the supervision of skilled birth attendant, and preferably in a primary health center, or in the wherever the primary health center in the rural areas refers you to the hospital. The lady should be taken to the mother should be taken to the hospital, and birth should be done under medical supervision in clean and hygienic surroundings, so that both the life of the mother and the child is not affected. Now, what is the focus? Why we want to know about the period of pregnancy in our course? We want to know because we want to emphasize the care that the mother should get during pregnancy. Nutrition, health care, she has to get at least 3 antenatal visits. The minute she comes to know that she is expecting, the antenatal visits should begin from that time, when they will constantly monitor her weight, her iron levels in the body, and the fetal sounds will be heard to determine whether the baby inside is developing heartbeat sounds, they are developing properly or not. Fetal movement will be known. Nutrition care has to be taken, about which you will read much more in the next course, which is DECE 2, how the mother's needs for energy, protein and certain other nutrients go up during pregnancy, and she has to be supported to take appropriate amount of food. She must be given priority. She has to be protected against diseases and disorders of pregnancy. So it is very important for the mother to be staying in situations where she does not contract a disease. And if she suspects that she has any disease, no medication has to be taken by your own. No tablet. No matter what anybody in the house may say that this is harmless, no medication to be taken by the pregnant mother unless it is under medical guidance, because the medication can have lot of repercussions for the baby, which repercussions show up even later in the life of the child. There are some immediate repercussions, immediate negative things can happen in terms of, some body parts not forming, the child having some sort of slower development of the brain. Anything can happen, including abortion can result, and so we have to be very careful. Mother has not to go anywhere near X-ray machines, etc., where she is feeling there may be a harm. So those has to be. And ideally, if a mother suspects any sort of an infection in her, she should get that treated before she plans to conceive the baby. So conceiving the baby has to be a bit of a thought out process as far as possible, so that the mother is very sure of her own health before she conceives. Smoking and alcohol consumption are very, very damaging to the fetus, and even to the child. After the child is born to a mother who has been smoking or who has been consuming any sort of alcohol, those children show lot of irritability and many other symptoms which are not appropriate for their development. Drugs, by these drugs we do not only mean the drugs of the drugs which cause you to go into different states. It is even the medical drugs that we are talking about. And the emotional state of the mother has to be very, very calm and unstressful. So this is being said because the family members play a lot of role in keeping the mother emotionally stable. She has to be kept in a relaxed state of mind, because emotional disturbance in the mind leads to production of certain type of hormones which are irritating and for the developing fetus inside, and which cause a harmful development. So these days, even with the pollution, it has a recent study I was reading in the paper has shown that the pollution, the suspended particulate matter which we keep talking about, has even been found in the placenta. So what we are trying to say is that everything from the mother's blood travels to the baby through the placenta, and therefore utmost care of the mother is very, very important.